Well, thank you very much, Alan, for joining us
Oh, it's
again
my
at the
pleasure.
Toronto Ottawa Heart Summit. And as usual, you give a fantastic overview in terms of areas that we all have a lot of questions about in terms of atrial fibrillation. And this year is going to give us an update. Maybe you can give us a little summary in terms of the exciting things you're going to discuss with us.
So absolutely. The CCS Guideline Committee every year reevaluates what we want to achieve. And so the 2014 guidelines are just in the pipeline to be published. As you know, the atrial fibrillation is a leading cause of stroke, and warfarin's been a major challenge to get into the community and make a big impact. So the novel anticoagulants are here. They're here to stay. The guidelines have just changed the recommendations a little bit in two important ways. The threshold for moving anticoagulation or implementing anticoagulation has really changed, just slightly. We've been using CHADS and CHADS-VASc, and so age over 65 now has become the first step in the algorithm. So we've simplified the algorithm to ask, if you're over 65, anticoagulation. If you have any risk factors beyond that, anticoagulation. And then we drill down into a really low-risk group who probably need very little at all. The second thing that we've done is, in the past, we've suggested that the novel anticoagulants be used in preference to warfarin, but this time we've really stepped up and said we recommend this as the preferable agent. And that's based on the fact that they're easy to use, that patients will actually take them, that they're more efficacious in some cases, lower bleeding risk, and more importantly, less intracranial hemorrhage, which is the worst of all bleeds. So in net clinical benefit, probably across the board, better to be on one of those agents than warfarin itself.
Wow,
so those are sort of the update.
Yeah, so, and I guess in terms of the other recommendations, or the workup and all the others are still remaining relatively similar?
So those are the fundamental changes. In the near future, we're going to put a series of questions together that we all get. What really is valvular atrial fibrillation and definitions and things. So you can look forward to that. The rest of the recommendations have had minor changes, but nothing really dramatic. Otherwise, they stay as is.
And where do the practicing physician to access this information?
So that's a great question. There's a number of websites. If you go to the ccs.afguidelines.ca,
most of it will be right
most will be there, yeah.
Yeah, great.
Okay.
Thank you very much again
My
for
pleasure.
a wonderful update. Yeah,
Okay,
look forward
thank
to
you.
your talk. Yeah.